My name is Naomi. I'm a licensed clinical social worker. On this channel, I teach about psychotherapy and what you can do to improve your thoughts, feelings, and behaviors. If you are new here, consider clicking the subscribe button below. It's free. Then you will be notified when I upload the new weekly videos. You can also find me on Instagram at Good Therapy. On this video, I teach you about proper breathing. Check out my video number 2 to discover the impact of breathing on your whole being and your whole life. On videos 4 and 5, I teach you positioning and guide you through a relaxation session. You should check with your doctor before beginning these breathing exercises to assure that this is safe for your health condition. If something is uncomfortable while you're breathing, don't do it. Learning a breathing technique is easy. Practicing regularly is where the work lies, or the discipline, but that's with everything: exercise, eating, now breathing. Who knew? Try to practice 2 to 3 times a day. Like starting a new medication, the full benefits may not be seen until after weeks and maybe months of consistent practice. You just have to have faith in yourself and know what I'm teaching you, that your breath is important. And if you take the time to breathe properly, it is going to positively impact your life. The main benefit is equipping yourself with the power of your breath to heal itself in all areas, including physically, mentally, emotionally. Then that focused attention taps into your spiritual awareness. Before you begin, you need to clear your airways, blow your nose if you need to, free your mouth of everything: food, candy, gum, snuff. Then clear your throat. If you have the time, wearing comfortable or loose clothing is beneficial. If not, that's okay too. Just loosen anything tight, especially around your belly or your neck. So if you have a tight belt on or tight pants, you want to just kind of zip them down. And I know that sometimes I want to pull my belly in because I want it to be flatter than it actually is. I want it to look flatter than it actually is. So if you have that problem, we're going to have to let go and breathe out. If you need to pause the video to prepare, go ahead. I'll be here when you return. On video number 4, I will teach more positions for deep breathing or diaphragmatic breathing. Right now, I would like you to sit in a chair that allows you to rest both of your feet on the floor or as close to it as possible. Then rest your back against the chair if you need support. I have my back rested against the chair because I like the support. Everything is uncrossed. The key thing is for your back to be straight with your natural curl. Your back with your natural curl. I want you to notice how you breathe. You can do this by placing one hand on your chest and the other hand on your abdomen, which is the area between your chest and your pelvis. So place one hand on your chest and one hand on your abdomen. Now breathe comfortably, paying attention to the movement of your hands, breathing in and out. Which area is rising the most? Your chest or your abdomen? Which hand is rising the most? Chest breathing puts stress on the body. The shallow breaths are unable to perform at the level needed to energize and fuel the whole body. Move this hand now from your chest to your leg, palm down. We're going to keep our hand on our abdomen. Abdominal, belly, or diaphragmatic breathing, which is the goal, allows the body to work more efficiently without stressing your system. The words diaphragm, abdominal, and belly breathing are used interchangeably because they are all connected in helping you to breathe properly. The diaphragm is the main muscle used for breathing. It is located under the lungs. The belly is part of the abdomen and strengthens the diaphragm's movement. So the belly down here pushes the diaphragm up, and it strengthens the ability to move the air in and out of your body. Now, let's begin by practicing breathing from the diaphragm down here Begin by inhaling slowly and deeply through your nose, then blowing out through your mouth. Paying attention to how I move my lips, making a gentle sound of the wind. As you inhale, feel the air move through your nostrils for about 2 to 3 seconds. Then blow out through your mouth for the same amount of time, 2 to 3 seconds. As you inhale, pull the air into your abdomen by expanding or pushing out your belly. You can monitor this by the hand that you have resting on your abdomen. Your chest should move only a little. Remember, we are trying not to use our chest and moving more towards our diaphragmatic breathing. So your chest should move only a little and only with your abdomen. As you inhale, cause your breath to push your hand or extend your abdomen as much as feels comfortable. As you exhale, slowly tighten or deflate your belly. As you breathe in at your own pace, count and pay attention to how long you inhale. Then control your exhale breath for the same amount of time. For instance, if it takes 3 seconds to breathe in, control the exhale for 3 seconds. Continue breathing and controlling your breath at your pace. Just make sure that you're breathing the same amount of time in and taking the same amount of time with your exhale breath. As you continue to breathe, think, I'm breathing in calmness and exhaling tension. Continue nice, deep breaths in through your nose and blowing out through your mouth. One more. In through your nose and blow out through your mouth. That's it. Now tell yourself, good job for taking the time to learn how to breathe properly. Practice as often as you think, because practice makes permanent. Let me know in the comments below how you did with this diaphragmatic breathing. Proper breathing begins with the first breath. If you are a smoker, you may have a difficult time with this exercise because of the smoke that you pull into your lungs. The body responds by overproducing mucus in an attempt to clean the airway. Thus, the mucus in the lungs increases and thickens. Your lungs cannot effectively clean out this excess mucus. So the mucus stays in your airways, clogs them, and makes you cough. Did you cough? All of this is your body's attempt to protect itself from your smoking, your actions. So consider helping your body by making a healthy choice to quit smoking. Just something to think about. You don't have to. Just something to think about. Well, I've enjoyed our time together. If you haven't already, consider clicking the subscribe button below. It's free. You will receive notification when I upload the weekly new videos. The more you watch, the closer it brings me to the views I need to continue making videos on this platform. Until next time, live healthy in your whole being, your mind, your body, and your spirit. Bye-bye.